Good morning, everyone. Welcome to another FYI on this Friday morning. And this morning I am joined by the Henry County Health Center, and we have a great conversation that you want to listen to because we're going to be talking about breast cancer awareness and the mammography services at the Henry County Health Center. Maybe you don't know, maybe you do, but October is Breast Cancer Awareness Month, and we're going to focus on those mammography services at the health center. I am joined on the phone by Berdelle Severson, who is in the Imaging Services Department at the health center. Good morning, Berdelle.
Good morning.
Well, why don't you introduce yourself to everyone and tell us what your role in the mammography program at the health center is?
I have been at Henry County Health Center for 12 years. I am the mammogram supervisor and the quality control coordinator.
So it sounds like you know all there is to know about mammograms.
I've done a few.
There's been varying guidelines and recommendations regarding that preventative mammogram. Can you tell us what those recommendations for mammogram screenings are? When people should start getting those?
Sure. The American College of Radiology recommends that every woman starts at age 40, and as soon as they start, they should receive a mammogram every year. If there's any type of family history or you're having any breast problems, you should come and get a mammogram done also.
You are talking about mammograms, and of course that is something that you guys offer at the Henry County Health Center. So can you talk about the Imaging Services Department and helping and to provide that mammography service to area women?
Yes, we have a really nice women's center that's relaxing and quiet. In our department, we do the 3D and the 2D mammograms. We do breast ultrasounds. We do a variety of breast biopsies. We also have Dr. Michelle Tansey, who is our breast surgeon. And then we have our infusion therapy department upstairs at the hospital.
So you have basically from the beginning signs of breast cancer to basically treating breast cancer, you can kind of do all of that at the health center?
Yes.
Awesome. So you mentioned when you were saying the things that you guys do, you talked about a 3D mammography. Can you tell everyone what the benefits are to receiving a 3D mammography and what makes it better than the traditional 2D mammography?
Sure. The 2D and the 3D, the imaging process that we do for the patient is the same pictures. So typically the patient doesn't notice a difference between the two. Our computer software generates usually between 200 to 400 images for our radiologists to look at. So there's a lot more information that they're going through. I always think of the 2D as like a whole loaf of bread, where the 3D, they're looking at each slice of that loaf of bread. The 3D can, show a lot more cancers that may be hidden with dense breast tissue. They can kind of look through that tissue, whereas before they just looked at that one picture. Increases the cancer detection by about 30 to 35%, decreases the biopsy rates by about 11%. We don't have to call people back as much. It decreases the callback rate by about 40%.
Wow, so they're getting a lot more information on that first try. So you only have to squish your boobs once versus maybe multiple.
Right.
So it sounds like the Imaging Service Department and the Mammography Department at the health center is really, really great as far as atmosphere and the people who work there and the technology that you guys can offer to area women. On that note, you guys have an event coming up in observance of October as Breast Cancer Awareness Month, and this is a great opportunity for area women. Can you give us some information on the Mammography Day that's going to be happening at the Henry County Health Center on October 16th?
Sure. It's from 8 to 3 that Friday. You don't need to schedule an appointment for that day. You can just come to the front of the hospital and register in the main lobby. You'll just need to register there, let them know what physician you would like your report to, and then you'll come back to radiology. It does need to be just a screening mammogram, no issues, no breast cancer, no breast implants, just a screening routine mammogram.
And what would you say, Berdelle, to someone who maybe doesn't want to get one?
everybody that comes in, nobody wants to get a mammogram.
Sure.
But most people, when they come in for their first time, every time they leave, they're like, that was not as bad as what everyone says it is.
So get your mammograms, get your yearly mammograms. And Berdelle, it sounds like this mammography day on October 16th, which is 1 week from today, Friday, from 8 to 3, is the perfect opportunity for someone out there to get checked with a preventative mammogram to make sure that they are breast cancer free. Berdelle Severson, she is with the imaging department at the Henry County Health Center and the mammography supervisor. It is Breast Cancer Awareness Month, so go get those mammograms and make sure you remind the people in your life to get their mammograms as well. And don't forget about their mammography day on October 16th. This sounds like a really simple way to get this done without a lot of headache. No appointment needed. All you got to do is show up, register, and get it done. So thanks, Berdelle.
Thank you.